All right, I'm Casey Mullen, and I'm going to be going through the multi-segmental flexion breakout and then the multi-segmental extension breakout. So first and foremost, for the flexion, we're going to basically go to the top tier first, and that is just essentially a toe touch. So I'm going to instruct the patient to take their fingertips and touch their toes while keeping their eyes on their toes the entire time. So, perfect. So here I'm looking for a uniform spinal curve, which we can see a little bit of kyphosis here in her mid-thoracics that we'll probably need to address. We want to see a posterior weight shift, and then her sacrum being at least 70 degrees or more of involvement. Also, we want to make sure, obviously, if she can even touch her toes. Okay, you can go ahead and stand up. After that, we're going to go into the long sitting. So if you'll sit down for me, you'll have your legs straight out, perfect. And then you're just going to do another toe touch. So just touch your toes for me. Again, we're looking for that posterior, her uniform spinal curvature. We're not going to see a posterior waist shift because she's sitting. And then obviously, can she touch her toes? And then also sacral involvement being at least 80 degrees now since she is sitting. Alrighty. The next thing we're going to do is we're going to do the active straight leg raise test. So if you'll lay down on your back for me. So with this, I'm going to have the patient have both of her, her palms up, anatomical position, nice and neutral. And I'm just going to ask her to raise each leg straight, keep it straight the entire time, up. So raise, perfect. Okay, looking to see if she can keep her knee nice and locked, nice and straight. And the biggest thing here is, can she get to her 70 degrees of hip flexion? Go ahead and lay that down. So we want her to get to 70 degrees of hip flexion. If she can't do this in one of her knees, one of her hips, then we're thinking, okay, is it hip mobility, or maybe she's having some sort of pelvic involvement that's causing her range of motion not quite to get to 70 degrees. So let's say hypothetically she couldn't get her left leg here to that 70 degrees of hip flexion. We need to go into what's called a stabilized active straight leg raise test to see if it's actually hip mobility or if it's maybe a pelvic involvement. So if you'll bend both of your knees for me, just slightly. We're going to put both of your hands in front of your head like this. So here I'm going to have the patient, she's going to push into my hands constantly throughout this entire movement. I want to make sure she doesn't have any posterior pelvic tilt. And we also want to make sure that her core is nice and engaged throughout the entire movement. So if you will push into my arm for me. Okay, keep pushing. Okay, I'm going to feel her core and just lower one leg at a time. Perfect. All right, now take this left leg here and I want you to raise it up. Well, keep pushing into me. Good. All right, now you can put it back down. All right, now relax for me. So the purpose of this is if there's a huge drastic change. So remember we said she couldn't get this left leg to 70 degrees during the active straight leg raise. So if there's a huge change and she's all of a sudden able to get it to that 70 degrees while her core is nice and active, then we're thinking, okay, maybe it was actually a core stabilization issue rather than a hip mobility. However, if there wasn't a big change, she's still unable to get it to that 70 degrees, we're needing to dive a little bit deeper. So now we're going to go ahead and compare her active straight leg raise to her passive straight leg raise. So with this one, just relax for me, palms to the ceiling again for me. Oh, sorry, to your side. Yeah, just perfect. And so now I'm going to compare her passive straight leg raise, and we can do this bilaterally. Since she couldn't get this left side to 70 degrees, we're definitely gonna do it on this one. So I'm gonna stabilize her opposite leg and just relax all the way, give me everything. And I'm just going to passively raise her knee, or her leg, excuse me. So with this, we're wanting her to get to at least 80 degrees now. So this is where we start to dive a little bit deeper. If she's able to complete this movement actively, not able to complete this movement actively, but she is able to do it passively, we're thinking, okay, maybe it's some sort of stability issue. However, if she's unable to do it active or passively, get to that 80 degrees, then we're thinking, okay, maybe it's a hip mobility issue. She can't do it active or passive. However, before we throw all of our eggs into one basket, we want to make sure that it's not her posterior chain that is actually causing her not to get to that full range of motion. So with that being said, we're going to go into a special test called the supine knees to chest test. And this is basically saying, okay, can the patient flex their hips to that 120 degrees without using their posterior chain muscles? Or do they need them? So that's what we're going to find out. So if you'll bring both of your knees up just a little bit, so just flex them for me. Perfect. Now I want you to take your hands, I want you to grab behind your thighs, right where your hamstrings are. All right, essentially turning off your posterior chains. And next I want you to pull your knees to your chest. Perfect. All right, so now what I'm looking at here is, can she get her that 120 degrees of hip flexion without her butt and sacrum coming off of the table? All right, so you can actually relax for me. So if she's able to do this, if she can get that 120 degrees nice and fluid without her whole bottom coming off of the table, then we're thinking, okay, maybe it actually was a posterior chain involvement that was actually causing that lack of range of motion. If she's still unable to get to that 120 degrees and her, her knees are buckling, coming out, abducting, she just quite can't get to that 120 degrees without her butt coming off of the table, then we're thinking, okay, maybe she does have a true hip mobility issue going on. All right, which you probably have some hip mobility issue going on. The last thing we're going to do is prone rocking. So this, I'm just going to be looking at her spine flexed. Okay, so that nice uniform spine. So if you'll sit up for me, and this is called prone rocking. If you'll turn and get on your hands and knees for me. All right. So with this, you are going to rock back to your feet. All right, and then you're going to take your arms and kind of bring them to your sides and curl in your, yes, good, and curl in your head, almost like you're trying to make yourself into a ball. So here the big thing, we're kind of going against gravity here, non-weight bearing, to be precise, and we're really looking at that uniform spinal curvature. So you can see right here, she's really kind of pushing out here, a little bit too much kyphosis here in her mid-thoracics, and this is just really showing us, okay, where can we go ahead and start? Where can we go ahead and start adjusting or whatever we need to do, so that way here in 10, 20, 30 years, she doesn't have super bad problems here in her thoracic spine. So that's it for the multi-segmental flexion. You can go ahead and stand up for me. So the next one we're going to go into is multi-segmental extension. So with this, it's kind of broken up into two different parts. We're going to have the spinal or upper body portion, and then we'll have the lower extremity portion. So to start with the upper body spinal portion, we're going to go ahead and just start with the top tier. So with this, we're looking for extension. So she's going to bring your arms up to yours. Perfect. And then I just want you to extend as much as you can. And right here, we're looking for, okay, can her ASIs get over her toes, which you can't really see? Can the spine of her scapula come from behind or come to her heels? And also that uniform spinal curve. Is there any dunking, which I can feel right here? She has a lot of dumping right there in her lower thoracics, just at the start of her lumbar spine. Perfect. Alrighty, from there we are going to, alrighty, so if you will sit for me. Alright, we're going to do what's called a press up. So actually, if you get on your hands and knees. Alrighty. And then you are going to lay your legs flat. Okay, and then have both of your forearms down. Perfect. And now I want you to essentially just press up your body as much as you can, keeping your pelvis nice. Yes, we don't want your pelvis to come off the ground. So with this press up, we're basically seeing, okay, can she have that nice uniform spinal curve, no excessive dumping? Also, are her ASIs, they shouldn't come off the table more than 2.5 inches, which hers are definitely a little bit more than that. So we're gonna have to dive a little bit more. You can relax for me. So with the multi-segmental extension, the thoracic spine trumps lumbar spine, all right? So since she doesn't have that uniform spinal curve, we're going to dive a little bit deeper and we're going to break up her segments. So first we're going to go ahead and go into the T-spine. So we're going to go into the lumbar lock test. So with that, you're going to get on your hands and knees. And actually, if you'll actually come to your forearms, so bring your forearms together and kind of put them between these a little bit. Perfect. And then rock back for me. So with this, if I'm testing her, yep, just like that. If I'm testing her left side here, the doctor will stand on the right side. So we're going to do this active and passive. Again, if I'm standing on the right side, I'm testing her left T-spine. So with this, I'm just going to ask you to place your this arm on your low back, or just wherever you go. Perfect. And then I want you to look to the left, and then just try to look up. And here I'm seeing, can she get to that 50 degrees, which she's not quite making it there, so we're going to have to dive a little bit deeper. And then you can relax here. Perfect. Then, now that I see that, active, she's not quite getting to that 50 degrees, I'm going to go ahead and do it passively. So with this one, I'm going to stabilize her hip with my hip, my shoulder right here, and if you'll put your arm on your low back again, or anywhere on your back, I'm going to loop around, okay? And then I'm just going to basically bicep curl and see if I can passively get her to that 50 degrees. And Not really. Yeah, she's kind of fighting you there. Did you have any pain or anything? You okay? Okay, perfect. Yeah, she's kind of fighting you there too. So active and passive are a little bit tough on her T-spine. Then we would also, go ahead real quick. We would do that bilateral and compare, so you get that back in that position. This arm on your low back. Perfect. Look to the side and try to look up, get to that 50 degrees. And you can see here she's again not quite making it to that 50 degrees. All right, face back forward. I'm going to stabilize her, and this one's a little bit better than her left side, but still she's not quite getting to that 50 degrees. All right. So if she were to have a stability issue, so remember she can't do it active or passive, she probably has a T-spine mobility issue, which I would definitely say you have some sort of bilateral T-spine mobility going on. However, if she were able to do it passive and not active, we would think, okay, T-spine stability issue. And if that's the case, lumbar and shoulder mobility trump T-spine stability. So we're gonna have to go a little further and do some more testing. So this next one we're gonna do is called the prone elbow test. So it's basically the lumbar lock test, and we're unlocking her lumbar spine. So if you'll get back in that position with your forearms just like that, except this time, and sorry about that, you might want to scoot up on the table. On this one, you're going to have to bring both of your legs flat. Perfect. So knees just like that, and bring both of your knees nice and flat. All right, so with this, perfect, just like that. And with this, we're going to do the exact same thing. We don't want to see her pelvis moving, and we're wanting to see at least 30 degrees this time. So remember, we're trying to unlock her lumbar so that way we can test it. So again, will you bring, if I'm testing her left side, I'll stand on the right. So we're going to bring this arm again to your back. All right, look to the left here, and then try to look up. And again, I want to see if she can get to that 30. So I can see her pelvis already trying to accommodate for this. Yeah, so definitely dysfunctional right here. Look back straight. I'm going to do this passively as well. So I'm going to come here. All right. So I would definitely say that both she's having a mobility issue. She can't really do it active or passively to get to that 30 degrees without her pelvis totally coming off that table. I would definitely do this bilaterally and compare sides. So bring this arm to your back, look to that side and look up. Again, looking for that 30 degrees, which I'm not seeing. Look straight for me. Come again and just kind of bicep curler. She has a little bit more movement on this right side, but still doesn't seem like she's getting to that 30 degrees. So I would say bilateral, that lumbar spine mobility going on. However, if it was more of a stability issue, we need to dive a little bit deeper. The next one is going to be the shoulder flexion prone test, and we would do this active and passive as well. So if you'll lay all the way flat for me, and you're going to slide off to the end of the table. Okay, perfect. And have your arm just kind of hang off for me here, and you can relax. You can stay like that. Usually her face would be in the notch of the table. And I want you to just bring this arm up all the way over your head. So perfect. And here we're wanting to see if she can get to that 170 degrees of flexion abduction of the shoulder. Alrighty, you're good there. And we can compare that bilaterally, but I think she's pretty good here. So now that we have all that done, we're seeing a lot of mobility issues with my little sister here. We're going to go ahead and jump into the multi-segmental extension lower extremity portion. So we're looking more at the hip extension of this movement. So if you'll actually get on your back, we're going to start with the Faber test, or Faber, however you want to pronounce it. Alrighty, so really here we're looking at, is it going to be more of her core being the issue here, or hip mobility? So Faber, we're going to flex, abduct, and externally rotate. So for the sake of how this camera is set up, I'm going to go ahead and test her right side. So if you just relax, I'm going to take your knee and I'm going to flex your hip, externally rotate, perfect. And I'm just going to push down here and I'm going to drop her knee here. And I want to see how far it is from this table. So she's having a little bit of issue here, not too much flexibility going on in her right hip. So with that being said, we want to go ahead and see, okay, is it because her hip's not mobile? Or is it because her core isn't stabilized, or she needs some strengthening going on? So we're going to move into the stabilized Faber test. So with this, we're going to bring your hands up again over your face, just like that. I'm gonna stabilize her knee, or her hip with my knee, and I want you to push into my hand, okay? Okay, push in, perfect. And I'm gonna have her hold it again, activating those core muscles, and I'm just gonna let go and drop in. Let's see if her knee gets a little bit closer to the table. Okay. So it did get a little bit closer, but not much. If it were to get a little bit closer, or 2/5 of the way through, then we're thinking, you can relax those. Then we're thinking, okay, maybe she just had a core stability issue or a strength issue going on here. If it weren't able to get any closer, then we're thinking, okay, maybe she does actually have a hip mobility issue. If that's the case, we're going to move on to the modified Thomas test. So if you'll stand up for me at the end of the table. Alrighty, so with this one, you're just going to kind of sit down at the edge, the very edge, and lean back for me and bring your knees to your chest. And here we're looking for more of a hip extension, so she was really having some problems, and you would be doing these bilaterally, but for the sake of time, I'm kind of pushing through them. So we'll go ahead and test this right side again. So I would stabilize her left with my body, and I just want you to lay this all the way down off the table. So a few things we're looking for here. Does her femur line up with her spine, or is it kind of abducting? Also, can she get to that 0 degrees of extension here, as in her femur touching the table completely? And also, can she get to that 90 degrees of knee flexion? Honestly, everything looks pretty good here. If she weren't able to get to that 0 degrees, there is another test that we would go ahead and dive into just to see, if she does have a hip extension issue going on. So the last one that we would do, if you'll get on your stomach for me. All right, and this is the prone active hip extension test. So since it was this right side, we're just going to stick to that right now. You'll just relax, perfect. And I want you to, yeah, perfect. And I want you to basically just extend or raise this leg as much as you can. And we should see at least 10 degrees here. Alrighty, perfect, you can lay it down. And so the biggest thing here is the 10 degrees coming from her lumbar spine, or is she actually getting that 10 degrees from her hip mobility? So since that's active, the best way is to move on to the passive portion to really see. So if you'll actually, I hate to do this to you, but I want the camera to see it. If you'll stand up and do the same thing but flip, put your head on that end of the table. Perfect. Alright. Yeah. So now I'm going to do this hip extension test passively. I'm going to put one of my hands under the distal portion of her femur. Okay, you can just relax. And then I'm going to find her ASIS. I'm going to stabilize here, and I'm just going to passively lift up her leg here, her femur, to see if she can get that 10 degrees. So I do feel a lot of that extension coming from her lumbar, so that's when we would kind of dive deeper and figure out what's going on. And that actually completes the multisegmental flexion and extension breakout. Thank you.